Indeed, thank you, Hussein, and thank you for staying tuned to Monday Special. Now, we're just coming from a month where we were talking about cancer all month, and it is estimated that cancer killed 7.9 million people globally every year. That constitutes 13% of total deaths worldwide. Now, back home here in Kenya, cancer ranks third as a cause of death after infectious disease and cardiovascular diseases. It causes 7% of total national mortality every year. But tonight on the show, we ask, is cancer really a death sentence? How do you react when you get the initial news? How do you live with cancer? And more importantly, how do you overcome cancer? My name is Jackie Maribe. Again, we are joined by our panel tonight. We have Mr. David Makumi. Thank you so much for joining us on the show. He is our regional program director, survivorship program at Aga Khan University Hospital. That's right? Correct. All right, next to him, we have Dan Obura. He is a survivor, 14 years, you said. All right, and finally we have Joseph Mureithi, another cancer survivor, 28 years and counting. Thank you all so much for joining us on the show tonight. I'll go straight into it, Mr. Makumi. When we talk about cancer and the initial news that you get cancer, for most people nowadays, people get shocked and it's as if they have gotten a death sentence. But is this really so?
No, certainly the news of getting a cancer diagnosis is very shocking. It's devastating because it disrupts, you know, what was obviously a well-programmed normal life. And reactions of shock, anger, despair, desperation are normal, a normal reaction. But maybe after the initial storm, you know, there is a phase to discuss the treatment plan, understand the diagnosis, understand the stage of cancer, understand what will be done from then on, and the plans of care are dependent on the cancer stage. Cancer is not a death sentence. In fact, we say cancer is a word, not a sentence. It's a word. It's not a sentence.
Indeed.
It's a word. And because for every stage of cancer, especially when we catch it early, and that's why we emphasize on early diagnosis, you know, we have the capability, even in this country, to treat it to completion and have people surviving for a long time. And that's why we're so glad that tonight we are talking about survivorship, because we have two long-term survivors. We have an increasing number of people living long after the initial diagnosis and treatment, and people who move on to continue with their normal work and become productive members of the society.
Indeed, and that brings us straight, you know, to Dan and to Joseph. I'll start with you, Dan. Take us through your journey. How did you find out, you know, that you have cancer? What happened in order for you to go to hospital and finally get that diagnosis? And if you could just share with us how, you know, what was your initial reaction to that?
Mine was, I had Hodgkin's lymphoma. So how I discovered that I had it was back in '99, and I wasn't the one who realized that I have it, because it was a tumor that developed on the left side of my neck. So I was just coming back, you know, from school. I was still a young kid by then. So I got home, and my auntie was the one who saw the lump. And from there we went to get our first diagnosis, and the results came out that it was just accumulation of fat. So what my doctor advised me at that point was just to change my diet from foods with fat to, you know, fiber foods. But with time it grew and became bigger. That's where we opted to get a second opinion from an ENT specialist who is my uncle. And from there is when he just did a physical examination, and he had a rough idea of what it was, and he immediately scheduled me for surgery. I didn't know what was happening because I was still very young.
How old were you then?
I was 12 years old. So I didn't know what was happening. I was there in Gators Children's Hospital. I did my biopsy, went back home. I still didn't know what was happening until I went through my chemotherapy. That's now when it clicked that I'm actually very sick. And the moment I knew that I did my first, second, and third, it hit me. I gave up on so many things. I gave up on even going to school. At times I used to sit there and, you know, as the drip was going through, you know, my veins, I'd be like, okay, so what's the point of, you know, of living? But the moment you have people around you, and people who actually push positivity in your life and show you that there is always going to be a tomorrow, you just have to fight it, because it's always a mental, it's a mental fight. So I did my chemotherapy. I finished. I still did, I used to go for my yearly checkups, which I still do, my yearly physical checkups. And at that moment, you'd find that there wasn't this sophisticated, you know, technology. Back then, it was, you know, you go to Nairobi Hospital for radiotherapy. This is like at 6 a.m. in the morning, and they get to attend to you at like 3 p.m. You know, it's really exhausting. But I made it through.
If I could just interject there and come right back to you, Mr. Makumi, that raises two issues there. One, time of detection, you know, early diagnosis, what that does then for someone who probably has cancer and is later diagnosed with cancer, and also, as you're saying, a support system, because as Dan is saying, he lost all hope, if I understand you correctly, and you wondered why then, you know, what's the point of going through all this. If you could just briefly tell us about when you get this diagnosis, what do we need to do in order for us to know that, fine, I have gone to hospital, or I have a certain concern, and now this could potentially be cancer?
Yeah. Once the test is done, because obviously you present yourself to hospital because you have specific concerns. Maybe a swelling, maybe you have long-standing constipation, they have taken a biopsy, maybe it's a lump in the breast, you know, there are tests that have been done. And ideally you should be told that we are taking this biopsy. A biopsy is a small piece of flesh from either a swelling or the lesion, maybe from a wound that is taken to a pathologist. So you are told this biopsy, this is what we are checking for. When you take a biopsy, you are looking at the nature of the tissue, the biology of the tissue under a microscope, and that is where a pathologist will tell us this is cancer. So you go with that information, that actually the tests I've done will determine whether I have cancer or not, whether my swelling is cancerous or not. And if you're told to come after a week or so, ideally you should come with somebody, a family member, a loved one, or someone who is around your support system. Some people come along with their pastor, others come with their religious leader, maybe their local imam, others maybe an uncle or a brother or a sister, or whoever is important to them when they receive this sort of news. So that when they are sitting with the doctor to discuss this, the initial shock, if they are told they have cancer, may be such that they may not register everything. So it's important to have someone with you who will maybe ask a few questions and ask the next steps. But more importantly, this is the person you are going to rely on. A patient of ours used to tell me, it's important to choose a team, you know, who is going to be on my side, and surround yourself with people who are positive, people who will help you absorb the news, but also be able to look at the whole scenario in a very positive way, so you are able to make a good decision.
All right. Before we come to you, Joseph, we have Doreen from Kasarani who says, my mom died of pancreatic cancer, whereby it was diagnosed very late. She was sick for 3 months only. She was treated rather, and pain was over. She died a week ago when she was only bones. She says, in quotes, Ameisha Nyamazote, I wish the disease was diagnosed earlier. Where are the machines to diagnose? Another question on late diagnosis.
Yeah, I really sympathize. Our sympathies go to that viewer. Certainly, there are certain cancers sometimes are very hidden, as it were. Pancreatic cancer is one of them, where the presentation may mimic other cancers. You know, it may not be very clear-cut that these sort of abdominal pains and so on are necessarily cancer. And pancreatic cancer, unfortunately, not only in these parts of the world, but also in the West, in North America and Europe, it's one cancer that is diagnosed a bit late in the day in terms of the stage. And you find that the patient may have been in the healthcare system, probably being treated for different things. So yes, we do have the technology right now to diagnose cancer, but there are a number of issues also that we need to address within the healthcare system in terms also of empowering healthcare professionals, doctors and other clinicians to think about cancer, that the patient who is sitting in front of me could well be having cancer among the many other things that
and not something else.
So we need to reprogram our thinking, our clinical judgment to know that yes, it could be malaria, it could be typhoid, it could be cancer, so that we are not so routine, and we should be able to pick more cancers, you know, early enough, so that we give patients a realistic chance of.
All right, and I'll come back to that, but I want to go straight to Joseph. You're saying now we have, you know, the necessary equipment. We are doing much better.
Absolutely.
But 28 years ago, what happened to you, Joseph?
Yes, thank you. No, I started back 1986. I had a painful, sharp pain on my knee. Whenever I walk, or in the morning when you go for a call. And in those old days we used to treat ourselves. You go for painkillers, and the pain comes down. Okay, it was just after my Form 4. So I went to Machakos Technical College for a certain course, and the pain deteriorated. I went to Machakos Hospital, where I was put on medicine, but I felt I was not feeling well. So I had to go back to my home village in Kirinyaga. I went to Keruwe Hospital, where I was taken an X-ray, and I was told there was some dislocation. So I was put on plaster. The leg was swelling. You have a plaster, it is swelling. So there was no space. It was so painful. I moved there to Tumotomo Hospital. They removed the plaster. Another X-ray was taken, and they told me, now we are going to take you to Kenyatta. So
by the time you're going to Kenyatta, you have not been told that it's cancer?
No. So on 23rd June 1987, I was admitted at Kenyatta. But before that, a week earlier, I had gone, and I was told to report after a week. So I went, and I was admitted. The following day, I was taken to theater, as Dr. Makome said, and I was done a biopsy, whereby the result took about a month to come out. And there was a doctor who told me they suspect there might be cancer, and if it is, the option is to amputate. That language was not very good to me. No, it was just after school. Now the question comes, now if I lose my leg, who shall I marry at this age? So I cried. In fact, I was taken to Kenyatta by my mom, who has been so close to me all the way through. I thank her. And after a month, I was told I have cancer. I heard them saying osteogenic sarcoma. And I was told I must be amputated. No, by then the pain was too much. So I told the doctor, even if you can tell me right now, I'll just agree. I can even send for myself. I have an ID. And on 24th, Monday, August 1987, I was amputated. After a day or two, I was taken for radiotherapy. They checked on the grades. They told me they are not swollen, and I was taken back to my bed in the ward. After I stayed at Kenyatta for 10 months, I took only one bottle of chemo, and from there I used to come for clinics weekly. After coming for 2 weeks, then after 2 weeks, then I was discharged from clinic.
But it must have been, you know, I imagine quite a major adjustment, you know, now having to deal with a prosthesis. That's well compared to having to not live at all or go through having an amputated knee. It was cut from the knee, right?
Above the knee.
Above the knee.
Yeah.
Now, having to deal with that is what I want to ask you.
Yeah.
Having to deal with that, and now you have to live with a prosthesis. It's been 28 years. That kind of decision that you're weighing in your mind, I know you're saying the pain was too much, as opposed to then people who maybe would not have discovered it early enough, would not have gotten help early enough, and it would probably have gotten worse. What went through your mind then, apart from, you know, the pain is too much, take it away?
You know, once you lose part of your body, that thing is not very encouraging. And especially when you go back to your home village, you feel yourself rejected, and you reject yourself. So when I went to home, and the people could come, hey, is this what you went through? You know, some questions you can't answer, you just cry. But I had my mom with me, who was there to comfort me, and he told me, let the wood heal, I'll buy you a prosthesis. And that's what happened. So in 1988, I came back to Kenyatta, to Kabete, and I bought this. In fact, I have not changed. This is what I bought from 1987, 88, up to now. And I've been that way. I was not married. In 1987, I got married.
You see a wedding band.
Yeah. And God blessed us with 2 ladies. My first girl is in Form 3. I have another one, is a candidate right now. I expected to be with her this evening, but Mr. Makomi called me. So life has not been so easy, but the best thing, once something has happened, you accept it the way it is.
All right. It is on that note that, you know, we want to take a very short commercial break, but when we come back, some of these things that, you know, as we're hearing now, how then do you live positively? How do you overcome cancer? Talk to us on 22422. What is your story? What are your thoughts on tonight's topic, and on at Citizen TV Kenya on Twitter? The hashtag is Monday Special KE. Don't go away. We'll be back right after these messages. Thank you so much for staying with Monday Special, and tonight we're talking about how to overcome cancer. Of course, there's a lot of, you know, different types of cancer, rather, those that people believe are more prone to women, those that people believe are more prone to men. However, in general, we're discussing how then do you live positively if you still have cancer and you're still getting treatment, and the survival stories, like we have Dan Obura and we have Joseph Moreithi, 14 years, 28 years, and that's something we're discussing, you know, over the break. It is believed now, because of the increasing trend of cancer cases, that it's something new. It's something that, you know, we would not have believed 28 years ago. You would have been diagnosed, you know, with cancer and have survived, and now be able to come here and share your stories with us. And again, Mr. Makomi, as we were just saying, more and more people are complaining about diagnosis, late diagnosis, and that being a factor to, you know, getting someone who has cancer at maybe stage 4, and so much could have been done if they had this diagnosed earlier. Now, my question to you again, I will just read one very quick message that I had just told you before. It seems to have disappeared. I'll come back to it. But in terms of the equipment that you're saying we currently have, how well equipped are we? Why are more and more people choosing to go outside and basically to India?
Yes, I think that's an important question, and it's a conversation that we have been having within the healthcare community. In terms of, let's start with diagnosis, or even start with this screening. You know, we need to get people aware about cancer and what to look out for, you know, in terms of public education and awareness. That is something we are able to do, you know, whether, regardless of whether we are talking of cities or rural, you know, in any county. Cancer prevention, for at least a third of cancers we can prevent, you know, tuberculosization, looking at lifestyle issues, you know, vaccination for HPV. Those are things that revolve around cancer prevention. So when we come to screening and consumption of screening services, you know, pap smears, for example, mammogram and so on, those are also things that can be done within the counties. You know, people don't even have to come to Nairobi to do that. Diagnostics. To diagnose cancer, especially any form of cancer, we rely on a tissue diagnosis. A tissue diagnosis is where we were talking about a biopsy, that a pathologist will look under a microscope and say that, yes, this is cancer, or it is not cancer. For nearly all the cancers, we rely on what we get from pathology lab. So in terms of whether our periphery laboratories are equipped, one, with equipment, and two, with the appropriate trained personnel. We may not be able to equip every single of the hospitals within all the counties, but working on a strategy that will ensure that the equipment that, for example, the minister launched a few months ago, that they are all within strategic locations within the country. Not only are they located there, but we have appropriately trained people to man them, because it doesn't have to have high-end microscopes, but then you don't have a pathologist to look through the microscope and tell you what this is all about.
So a skilled resource as well needs to be up.
We are not where we should be, but certainly not, we don't have pathologists all over the place. We are not where we should be, but do we have the capability? Yes. Can we meet all the needs of every single Kenyan? We are working towards that. So that's very, very critical, that if we have a mechanism of a proper referral chain mechanism, so that even if a hospital does not have the equipment, but they know where to send the tissue and they get the results in good time, then we are still able to diagnose early enough, and once we know it is cancer, then we also know what to do next.
All right. Again, we're discussing then how to prevent, you know, these cases, how to live positively, and therefore to improve the quality of life of those who are currently living with cancer, and also tell our survival stories. I have with me National Cancer Control Strategy 2011-2016, and you know, they give the key interventions that we should be taking as well as a country, and we will be discussing this with you, Mr. Makomi. We have primary prevention of cancer that would cater for about 40 cases. These are the basics. 40%. Tobacco smoking, if you know therefore that it causes cancer. Promotion of healthy diets, physical activity, and protection against exposure to environmental carcinogens. I want to come straight to you, Dan, on this. From 14 years of, you know, going into remission, that's what you say, right? How have you had to change your lifestyle, therefore? Because this doesn't mean that you're not at risk of getting any other form of cancer then. How have you changed your lifestyle?
First, I'd say, when you look at you being in remission and being cancer-free, there is what you expose yourself to. I do have my peers. We hang out in, you know, different scenarios, and you'd find that at times someone will be smoking, and basically that's more or less like secondary, you know, smoking. There's all about what you eat. your fatty foods, foods that basically the body doesn't or quite digest. So for me, it's more of the information is, it's out there. So it's you basically being real, with yourself. We know that there's nothing in specific that we've highlighted in terms of that can trigger cancer. It just happens. It can be genetic. It can be, as I explained, what you expose yourself to. So it is you just appreciating your body and respecting your body at most.
All right.
Yeah.
And when we're talking about survivorship, then it's not just one thing. It's the stigma that you have to deal with.
Yeah.
It's the social economic status that you have to deal with. It's also the medical expenses as well that you have to deal with very quickly, because my director informs me that we're just almost running out of time. But for your survivorship, 28 years down the line, what are the initial things that you had to deal with? You said, of course, some of this is stigma. You went back home, people would point and say, this is how you will live the rest of your life. What else had to change in your life, and how have you been able to live positively in as far as those who are watching are concerned?
No, thank you. No, there are some things which you are doing before which you can't. For example, once after coming from Kenyatta, you're not in a position to carry a basin of water to bathe for you. So you need a support from somebody else. Whereby I was telling you, I had my mom and my brothers who are younger than me. In fact, I'm the second born in the family. So the others are behind me. And after that, I thought you have to accept yourself the way you are. Now this thing, it has happened. You are not going to hide yourself in the house. You are a man. You have to face the world. So I went out. And after some time, you talk today, tomorrow keep quiet. So I started farming with my one leg. I had a small shamba, planted cabbages, whereby we sell and got money, and with my brother bought a cow.
So it was a deliberate choice, and I know this is where pain relief and palliative care comes in, but it was a deliberate choice for you not to sit in the house and be sad and sulk, but to face life and move on, right?
Yes. And after some time, I left home. I came to Limuru. I joined Bata in 1992. That's where I work. And I work as other people. I start from morning, 7:30 in the morning, up to 5 or 5 in the evening. And people could complain, hey, I'm so tired. So, and I'm very comfortable. I can work from Monday to Monday. So, God gave us strong energy to start.
What is your message therefore, to those who are watching at home, those who are still going through treatment, those who may feel downtrodden and don't feel like they can pick up the pieces? 28 years, that's a very long time. That's, we will not expose some of our ages here, but that's a very long time. So what is your message for those at home that are still going through?
I can just encourage them that cancer is not under the sentence. And it is good to be checked, as Dr. Makuna said. For example, we have a foundation in Limuru, Progress Mwaru Foundation, Cancer Foundation, whereby we have visited schools, churches, and we do diagnose, we do screening. But the problem now here comes in money, because the nurses or those medics who will come, they need money. There are some things which are needed for those tests. We don't have money, so at the end of the day, you get there maybe 2 or 3 patients. But from there, we have to treat them.
Indeed, and I'll come back to that. You will answer that for us. Dan, for those who are watching at home, you're standing tall and proud and looking good. So what is your message to them? Don't blush.
Thank you. What I'd say is, living at this time, there is a lot of information out there in the internet, on your phone, on your tablet, on your computer. So take advantage of that. It's not always about, you know, going online and seeing things that are more or less of, like, you know, irrelevant to your life. At times, take your 5 minutes, 10 minutes, learn about your body. There's some cancers you can actually diagnose on your own, like
self-examination,
self-examination and all. So don't be ignorant. It's never bliss. So it's better you keep yourself with abreast of the information that's out there.
All right.
Yeah.
Okay, thank you. And Mr. Makome, as we wrap up, where then do people go? That is the question, actually. We all want to know, where do you go for treatment in Kenya? Where do you go for diagnosis? Just as we finish, very quickly.
Yeah, thank you very much. Once a diagnosis is made and confirmed that this is cancer, there are established cancer treatment centers. Unfortunately, majority of them are situated in the city within 5-kilometer radius of each other, and comprehensive cancer services, especially in public sector, are available in Kenyatta. That means radiotherapy, chemotherapy, cancer surgery, and so on. That's available in Kenyatta. We have a center in Eldoret, which is also public sector, MTRH. They don't have radiotherapy, but they're doing a lot of good work, and they should be launching their radiotherapy pretty soon. But they're doing a lot of good work. They have oncologists, and they're able to take care of chemotherapy, screening, and so on. And we also have a number of private sector players within the city that have invested in comprehensive cancer treatment, right from screening all the way to palliative care. So that's available. What is important for us as a country is to define what services, what cancer services will be available at what level. At a dispensary level, what can we do? Smoking cessation, vaccination for hepatitis B and HPV, lifestyle modifications, that we can do even at health center and dispensary level. Then as you go up at the county hospitals, the county hospitals, the former district hospitals, some of the screenings like mammograms, our counties and our governors need to invest in those things. Screening equipment, those are things that they can do there, equip their laboratories so that they are able to pick up the diagnosis at that level. And then as you climb higher up, the ministry has been working on 4 regional centers, cancer centers. So that then as you climb higher up, you can have the treatment infrastructure like radiotherapy and chemotherapy and so on. We as a country cannot afford radiotherapy equipment for all the 47 counties. It's just not practical. But we can have a number of centers spread out across the country where patients can be referred. So, and also equipped with good imaging, like CT scans, X-rays, MRI. I know a lot of Kenyans keep asking, do we have PET scans in this country? We don't have yet, but we know there are investors who are working actually in terms of bringing a PET scan into this country. Does every single cancer patient need a PET scan? The answer is no, because a PET scan is a diagnostic tool as well. It also does help us in terms of monitoring, response to treatment and decisions around that. But not every single, even when as a country in the next several months, when we have PET scans in town, it's not like every cancer patient will have to go through a PET scan. These 2 gentlemen were treated in this country, more than, between them, we 28 years, 14 years ago, we didn't even have as good infrastructure as we have now. They didn't even have, none of them have ever seen a PET scanner, and they are not disadvantaged. They are not disadvantaged at all. So, even for our patients who are being treated for cancer, let your doctor decide. They will decide what tests you need and at what point. Sometimes there is information, people go home and they are told, oh, did your doctor do ABCD? Cancer is treated in such an individualized manner, in a customized manner, that even if we have both the same type of cancers, like you might have 3 women with breast cancer, and each of them will have a different form of treatment approach. It's so customized and individualized, so not everyone will have the same test, you know, over and over. And I know, you know, of course, the people have been talking about the medical tourism and the number of patients that are heading off to India, and they do have some of the things that we don't have over here, but certainly we also do have the issue of cancer treatment in this country. The major problem is cost and access. And what we as a country need to look at is utilizing the private sector infrastructure through public-private partnership, work a mechanism through which patients in public sector can also access this. And maybe even look at having KEMSA stock chemotherapy drugs, which would buy that in bulk, and that would also bring the cost, you know, dramatically down. So there are models we can use as a country to make sure that these costs do not remain as high as they are. It's unacceptable that we have infrastructure, we have expertise, we have drugs, but people are not able to access because they can't afford they can't afford that kind of treatment.
And that's one of the concerns that I'm seeing from a lot of people. Cost. And this conversation will continue. We're running out of time, but we will be giving you this and much more of what he is saying, where you can go therefore for help, for diagnosis, for treatment, the available options that you have. You can visit us on citizentv.co.ke. Again, that's citizentv.co.ke. Any and all information, you will be leaving us with that. Of course, this is a conversation that will go well into the night because there's so much to talk about. But we will be coming back after a short break with what you think about this topic. What have your experiences been? Hussein Mohammed will be joining me in studio right after this break. Don't go away.